Hello, and welcome to our White House webinar on the annual report for the American Pandemic Preparedness Plan. We are thrilled that you are joining us today. You are joining us from all corners of our great nation and the world. We always extend a special welcome to our international audience and remind everyone that a global pandemic requires a global response. We are partners with you as we fight against these pathogens together. I'm Matt Hepburn and kicking off the session here. And I think it's always important that when we get into a conversation about pandemics and pandemic preparedness, we start with a bit of reflection on the horrible, horrible tragedy that we have all went through. And for me personally, I always feel like there are times when I don't really want to think about it anymore, and I want to move on, and I want to, get on with my daily life. And I don't think we can have this conversation without starting with acknowledging how horrible COVID-19 has been for all of us. Today, however, is focused on if there is a silver lining, it's focused on that silver lining, because we are presenting you a progress report that demonstrates what I would call just extraordinary innovation and effort to make sure that pandemics never happen again. In this progress report that you'll hear about in this webinar, and it's now publicly available, so you can look it up, you'll see a strong section on the efforts of the United States government in close partnership across all of our society, across domestic and international, in terms of doing all of the things really comprehensively to ensure that pandemics never happen again. The second section talks about our goals for next year. And what you're going to hear about today is a blend of both of those. And it's going to be in a fireside chat format. We thought it would be most compelling to instead of just presenting a bunch of slides, to give you dialogue. And I am absolutely thrilled and excited about the people that you're going to hear from. These are true selfless servants in our government, and they're going to tell you about what they've learned, what they know, and really give you a candid appraisal of where we need to go next. So let's get started. I am super, super excited to introduce Dr. Alondra Nelson, who's going to kick off our program today. Dr. Nelson is the acting director of the Office of Science and Technology Policy. She's the first social scientist and woman of color to hold that role. Dr. Nelson leads 6 policy teams in their work to advance critical Biden-Harris administration priorities in science and technology. She is a deputy assistant to the president and has also served since day one on the Biden-Harris administration as the deputy director of the newly created OSTP Science and Society team. On a personal note, I love working for Dr. Nelson, and it's the simple reason that she leads by example. She truly, truly inspires me, and she inspires all of our team with the values that she upholds. And I would argue her deepest value is this idea of equity, meaning that no one is left behind. And that, I think, is conveyed very clearly and consistently throughout our annual report. And it will be something that our office and, frankly, that our government will continue to push forward. Dr. Nelson.
Thank you very much, Dr. Hepburn. You mentioned the selfless servants who are with us today to share some updates from their work. Chief among these selfless servants, it would be you at OSTP, where you serve as our senior advisor for pandemic preparedness. It is a great joy, honor, and privilege to work with you every day. Thank you for your leadership in this space, and thank you for the work that you and the team have done to organize this update event that allows us to share with the American public what we've been up to in this space over the last year. So as Dr. Hepburn noted, I have the great distinct privilege of leading the Office of Science and Technology Policy, or OSTP, where we work together to maximize the benefits of science and technology to advance health, prosperity, security, environmental quality, and justice for all of America. By its founding mandate, OSTP is focused squarely on the future. And indeed, we're probably the only component within the EOP, the Executive Office of the President, that has this kind of future-focused mandate. In our work, we envision how science and technology can help shape a safe, equitable, flourishing world by tackling the tough challenges we face today, anticipating the unknown opportunities and obstacles that may lie ahead, and driving boldly toward both discovery and solutions. As we all know, and as Matt so poignantly said at the top, we're still dealing with the COVID-19 pandemic and its permutations. We also know there will be more pandemics, and we need to be ready for them. In a letter he issued just before taking office, President Biden asked, I'm quoting him, "What can we learn from the pandemic about what is possible or what ought to be possible to address the widest range of needs related to our public health?" Close quote. And on his first day in office, the president issued 2 key executive orders, one on advancing equity and one on strengthening the United States response to COVID-19 and being a leader in the world on global health and security. To answer President Biden's question and follow his directives, we're taking steps to ensure the United States is ready to respond effectively to future pandemics and to iterations of this pandemic. We have a responsibility to future generations to work with urgency now, to transform our capabilities, to contain outbreaks before they become epidemics or pandemics, and to take the threats of pandemics off the table completely. To do this, OSTP and our colleagues at the National Security Council and the White House COVID response team have been carrying out the work of our American Pandemic Preparedness Plan. This plan outlines a bold vision to directly address future threats and reduce associated inequities by transforming our medical defenses, ensuring situational awareness through early warning systems and real-time monitoring, strengthening public health systems, including domestic and international health infrastructure, building core capacities across supply chains, and managing the mission by ensuring accountability and working collaboratively with the international science community. Since we released the American Pandemic Preparedness Plan 1 year ago, the US government has worked diligently to implement these goals, though more investments are needed. Today, in coordination with 16 other departments, agencies, and offices, OSTP is releasing the first annual report on progress towards implementation of the American Pandemic Preparedness Plan. This annual report summarizes progress towards advancing the goals plans and recommends priority areas for investment and focus in the year ahead. As the report shows, the American Pandemic Preparedness Plan has sparked a renaissance in vaccines and therapeutics and diagnostics and in research and development to stop, treat, and detect pandemic threats. The plan has also strengthened early warning of emergent threats. We now have the ability to detect viral threats anywhere in the world within days or weeks of their emergence. We have also seen new approaches for detecting threats using genome sequencing and wastewater sampling to aggregate and analyze pathogen data. We've gotten better at tracking pandemic threats by combining diagnostic, epidemiological, sequencing, and environmental data. Even with all of these advances, transforming our capabilities will not be enough to eliminate the burden of pathogens, especially in vulnerable communities. Scientific and technological advances are now being paired with public engagement, trust building, and recognition of previous harms and challenges in public health. The report highlights key objectives for this coming year, including more efficiently developing and manufacturing broadly protective next-generation vaccines, as well as spurring innovation and preventative technologies and in healthcare delivery, as well as accelerating the production of treatment so that everyone can get the care they need. This work at heart is about taking care of one another. It's about listening to our frontline workers and protecting ourselves, our loved ones, our friends and neighbors, and our fellow communities around the world. It's going to take all of us working together to achieve this vision, and we don't have a moment to waste. we're really delighted that you can be with us this afternoon for this important conversation. And I turn things back over to Dr. Hepburn to get us started.
Dr. Nelson, that was wonderful. That was just fantastic. Dr. Nelson, that was wonderful. That was just fantastic. That was amazing. And greatly appreciate your comments. I will say that at Office of Science and Technology Policy, we practice what we preach. We emphasize transparency. And that's why you see an annual report that is public, in which we welcome dialogue. We practice collaboration. We are not doing this alone. We have collaborated across bringing all the best of our federal government together, our state and local governments. But our goal here is all of society, not a cliche. Our goal is to catalyze the best in all of us so that pandemics never happen again. And lastly, and you've already heard it a few times, but we're going to keep saying it again, is this idea of equity, that no one is left behind. It's so important to us. And that's why we are leading with it. We are leading in this, and our first panelists are going to be addressing equity. So we're going to get right to fireside chat number 1. This is bringing innovation to the people. And I am I'm excited about all 3 panels. We're not going to say which one's best. We're not going to do that. But what we will say is that we are kicking off with 2 amazing individuals. I call both of these women heroes of public health. And I don't use the term hero lightly. Let me introduce them. So first, Dr. Carolyn Green. So since January of 2022, Dr. Carolyn Green has served as the Deputy Director of Science and Policy at the Office of the Surgeon General, on detail from the CDC. Prior to joining the Office of the Surgeon General, Carolyn served as the Acting Deputy Director of the Influenza Preparedness and Response, and also as a Field Site Support Unit Lead within the Influenza Division in the National Center for Immunization and Respiratory Disease at CDC. I will tell you that Carolyn has personally inspired me on how we build trust with communities. She's clearly devoted her career for that purpose, and she uniquely demonstrates as a professional colleague, empathy and understanding. And I'm sure that's going to come out in the chat. Also, we have Dr. Nahid Bedelia, who is the Senior Policy Advisor for the Global COVID Response on the White House COVID-19 Response Team. She is an infectious diseases physician, the founding director of Boston University's Center for Emerging Infectious Diseases Policy and Research. And over the last decade, Dr. Bedelia has designed and served as the medical director of the Special Pathogens Unit over at Boston Medical Center. We should also add that she is truly an international response hero in terms of all the work that she's done on many Ebola outbreaks on the front lines, taking care of patients. And if there is one thing about Dr. Bedelia, it is that she always puts the patient first. And I'm sure that's going to come across when we hear from them. So, Carolyn, I'll turn it over to you.
Thank you so much to Dr. Hepburn and Dr. Nelson and everyone at OSTP for inviting me to participate in this webinar on the American Pandemic Preparedness Plan. I will say that I was fortunate enough this year to represent the Office of the Surgeon General in the Pandemic Innovation Task Force. And what was immediately apparent was the tremendous expertise and talent there is for innovation and countermeasures, diagnostics, therapeutics, vaccines, PPE. But what was also immediately apparent is the need to invest and dedicate expertise, energy, and resources in bringing these innovations to the people, to all people with equity. And for that reason, we formed an interagency working group. And the name of our working group is lengthy but descriptive. We are called the Building Trust and Designing for Health Behavior Uptake Working Group. We continue to meet informally today because we are committed to promoting health behavior uptake in all communities with equity. We realize this is a tremendously difficult task. It requires a multi-pronged approach, but I do just want to review sort of 5 principles that I think we are trying to adhere to. 1, promoting health behavior uptake requires building trust in science, public health, government, and health agencies. 2, in order to build trust, we must engage with all levels of government, communities, societies. We must sort of step away from a top-down approach and instead engage local leaders, representatives, spokespersons as we work. 3, it is critical to, when we are producing new medical products or public health interventions, it is critical to engage communities at the very beginning. In this way, we can ensure that we have human-centered design, usability, acceptability, and that we're able to reach all communities. 4, as we develop these partnerships across levels of governments, across communities, across societies, it's important to maintain these relationships in an evergreen fashion. We have to work together both between and during public health emergencies. And finally, 5, we have the need to build the capability to address the root causes of misinformation, to communicate effectively across communities in our current health information environment, which is increasingly complex. So I just want to end the same way that Dr. Hepburn just ended by saying I am thrilled that we are beginning this webinar, this session today, with bringing innovation to the people with equity, since this is such a critical piece in the success of pandemic preparedness and response. And I am particularly pleased to be having this conversation with Dr. Nahid Badilia, who brings such valuable insight and expertise to this topic. So Dr. Badilia, thank you.
Dr. Green, thank you so much for those remarks. And thank you, Dr. Hepburn and Dr. Nelson, for starting us off on what's important, which is why we do this, why do any of this, which is that we've learned the lessons of and the costs of what happens when we don't prepare for the threats that are emerging with increasing speed. I also want to thank the OSTP for bringing it together for the AP3 annual assessment launch today. It has been an honor to co-chair the Steering Committee for Pandemic Innovation with Dr. Matt Hepburn as we take a short-range and a long-range view on how do we build science and technology capacity to improve our resilience against new emerging infectious diseases threats, and to do that more equitably. And whether it be my current policy position or my work as a frontline clinician that Dr. Hepburn talked about, or as a researcher, I think that idea that you need to start with equity at the beginning rather than as an afterthought, it is so critical. And I just want to go through in my remarks a couple of reasons why it has to be at the beginning. First, we act on what we can count. And when we talk about the importance of investing in data systems and surveillance systems domestically and globally, picking up those kinds of data streams allow us to understand not just the burden of disease, but to also be able to pick up the signal from the noise. When we talk about the idea, the impact that COVID-19 has had on the world, right? In May, the World Health Organization released that about 15 million additional excess deaths were caused during the COVID pandemic, both due to the disease itself, as well as lack of access to care to address other ongoing medical conditions. We need to figure out what people are dying of, as well as what they're living with, to be able to address, these problems more equitably. 2, it's important to start with the equity at the beginning because diversity and who sets the research agenda at the very beginning determines how thoughtful and how integrated our operational systems are in understanding how these problems affect all our communities. And so when we talk about research capacity and clinical trials capacity, the importance of doing that, not just here in all our communities, but globally in low and middle income countries through work that NIH and others are doing already through the Ebola outbreak that we've Dr. Hepburn talked about, with trials such as the Prevail trial, or more recently the work that was done in Democratic Republic of Congo, including local researchers and helping set the research agenda in a more equitable way is important. 3, what you said, Dr. Green, is so important. We can create innovations all we want, but to create innovations that are useful to all our communities, we need to include those communities in that research and trying to figure out what is needed and what is going to be acceptable, affordable, accessible. And that's sort of the critical principles of equity. And then lastly, the reason why we have outbreaks is because early detection matters. And at the terminal end of all infectious diseases, surveillance for infectious diseases, are communities that don't have access to care. About half of the world lacks access to essential health services and diagnostics and treatment. So we can't figure out when there's a new threat when there are already gaps in equity at the very beginning. So intention matters. And it's not just that the principle of equity is important because it is so critical, but it's also critical to the operational success for pandemic preparedness. So I'll end with that and pass it on to you, Dr. Green.
Thank you so much, Dr. Bedelia. You've already begun to answer my first question, but I'm going to pose it anyway to give you a chance to even add to your wonderful opening remarks. Clearly, we all on this call and in this webinar agree that equity is central to U.S. actions on pandemic preparedness. I just wanted to give you an opportunity to sort of continue to discuss why that is and perhaps even provide some examples.
Yeah, I'll start by saying infectious diseases make it so obvious how interconnected the world is. I mean, I think that when you talk about preparedness, pandemic preparedness is a global exercise that includes all of our communities, because an outbreak anywhere is an outbreak everywhere. You know, and that connection, it's manifested in the way that we live our lives. You know, as the population increases, right? The population has doubled since I was born on the face of this earth, and we're closing that distance between boundaries between animal and human habitats. We're increasing the risk of spillover events of new pathogens that may exist in well-balanced, reservoirs that are now being introduced into the human population. Protecting vulnerable communities, particularly at those front lines, allows us to quickly pick up those threats and respond to those threats before outbreaks become epidemics and epidemics become pandemics. But we're also very much interconnected. And so the importance of equity and making sure that those outbreaks or those first cluster of cases are quickly identified is critical, because look at the way we travel and live. In 2019, 1.46 billion people took a flight. Everything in the world is now one flight away. The way that we trade, the way we seek healthcare, everything is connected. Our supply chains are connected, and hence ensuring that there is sustainability and resilience in the response at all our global communities is important for that reason. Second, here's my experience with all the outbreaks that I've been part of as a clinician at the front line, which is that outbreaks attack us at our known fault lines. If we don't protect vulnerable communities, and overwhelmed healthcare systems affects all of us. If we don't protect essential frontline workers, it affects all of us. And those barriers to care that exist even before epidemics or outbreaks are actually just accentuated. So that importance of equity starts at the very beginning. When we build a more equitable access to healthcare or public health resources, we are inherently building a more resilient system against new pandemic threats. The other things that I'll talk about is that, we've made some efforts over the last year, for example, to be able to sort of ensure that those gaps in access can be built better. One can be better bridged, but we need to continue to invest in them. One example is the Federal Retail Pharmacy Program, a partnership between CDC and 21 partner organizations that are pharmacies that helped make COVID vaccines available to over 284 million Americans, including many communities of color and underserved populations. Or the U.S. Global Vaccine Access Program, what we call Global Vax, which is established to increase that same kind of global COVID vaccine uptake in low and middle income countries.
Wonderful, very, very comprehensive. I will add two small examples of interest that are mentioned in the AP3 report, and these relate to, again, as you've talked about, equity in promoting behavior uptake across communities. The CDC's Vaccine Task Force formed an insights unit that collects data from 24 sources to better understand the concerns, frustrations, and questions related to vaccines across communities. And then they can use this with their partners to develop communication strategies for communities most at need. Similarly, the Veterans Health Administration launched 3 rapid response teams that collected data in real time, qualitative and quantitative data, to better understand vaccine confidence and vaccine hesitancy in both veterans and employees. And once again, this allowed them to then create communication strategies for use by trusted healthcare providers and colleagues to promote vaccine uptake. So again, these are the themes that we're seeing throughout. I'm going to switch a little bit here and broaden to a topic that I'm especially excited to hear about from you, Dr. Bedelia, given your extensive experience. Clearly, equity is important in both domestic and global public health responses. So I'm curious to hear from you if you could share some of the ideas from the AP3 report related to global health equity.
Thank you, Dr. Green. I'm going to put them into 3 specific themes. First and foremost, one of the things that the neglected dimension of global health security report that was released after the West African Ebola epidemic said was that we exist in a cycle of panic and neglect. We tend to respond to outbreaks, and when they disappear, we forget about them. And what the important part of the work that we're doing today, and what you'll see reflected in the AP3 annual assessment, is the importance of investment and intention, common goals that are set, and then money that is being put behind it to ensure financial stability to be able to attain those goals. And that includes strengthening international infrastructure for pandemic preparedness, providing financing, improving capacity for production for medical countermeasures, and then ensuring equitable access to those resources during a public health response. And we do that, the United States does that along with other WHO states by working on strengthening pandemic preparedness through approaches such as the International Health Regulation, Monitoring and Evaluation Framework, and working to identify core capacities and continuing to build ways that we can collaborate more quickly during pandemic threats. In 2020, for example, the G7 leaders committed support for up to 2027 for at least 100 low and middle income countries in implementing the very core capacities that are identified in international health regulations to surveil, identify, and respond to new threats. The U.S. has also been working with 40 countries, including the 19 Global Health Security Agenda countries, investing in over $2 billion since 2015 in helping with operational and technical assistance in meeting those core capacities. And most recently, part of this intention is working on the idea of a 100-day mission with the appearance of new threats, and ensuring that we have diagnostics, vaccines, and therapeutics ready to go. So that kind of financing to try to get preparedness ready is needed now. It's not something you commit to when there's a threat. And the way that the U.S. has done that is through support of organizations partnerships such as the Coalitions for Epidemic Preparedness and Innovation. We gave a historic $150 million to stimulate and accelerate research on priority pathogens that are biological threats. And the last part is the U.S. government has helped support development and implementation of the World Bank's Financial Intermediary Fund for Pandemic Prevention, Preparedness, and Response. The State Department has contributed $450 million to this FIF, which will help finance critical investments to strengthen pandemic preparedness at all capacities, at national, regional, and international.
Wonderful, thank you. Clearly a theme that's emerging here is the importance of partnerships, whether that's partnerships at the local community level or our global partnerships. Clearly these relationships are so critical to us addressing equity moving forward. So my final question is actually a look ahead. I would love to hear, Dr. Bedelia, what you are most excited about in terms of how innovation can improve equity in our future pandemic response efforts.
Yeah, exactly. For the reasons that we talked about, I think what I hope is that our long range vision, our priorities that we've set through this report are going to take us from being a culture of outbreak response to one of at least outbreak preparedness, and ideally one of outbreak prevention. And I think that we do that by doing a few different things. One, we need to integrate pandemic prevention into understanding and taking care of the endemic burden of disease. And for example, diagnostics are a good example of this. One of the things that the AP3 report talks about is this idea of building diagnostic capacity for the world through multiplex platforms that help identify not just endemic infectious diseases, but also high priority pathogens that have the capacity to potentially cause an epidemic in the future. In 2021, the Lancet Commission on Diagnostics mentions that about 47% of the world doesn't have access to essential diagnostic services. If we don't know what people are getting sick with, how can we figure out if a new disease has spilled over from animals into humans? And to do that, we need to, these multiplex diagnostics are exciting because they build on the work of, for example, the Global Access Program that was built in 2019 that helps identify endemic infectious diseases such as HIV and tuberculosis and elsewhere. But this would integrate now ability to quickly get easy to use diagnostics and a lot of laboratories around the world that also pick up the signal from the noise with new priority pathogens. The work that's being also done to increase broad-based antivirals and vaccines are critical because we need these antivirals for both endemic as well as priority pathogen diseases, Crimean Congo hemorrhagic fever, or Lassa fever, which affect many parts of the world that are on the priority pathogen that already carry a population burden. Getting antivirals that are broad-based through work through NIH's and BARDA's antiviral program for pandemics is going to help alleviate some of that burden because it'll help identify patients early to bring them to care, which of course increases chances of survival. The other reason I think we need to link pandemic preparedness to endemic burden of disease is because we need to create a healthy bioeconomy. We need to have a demand for endemic burden diseases, diagnostics, as well as treatments, and link that to pandemic preparedness so we can have sustainability. Now, the U.S. has done a lot of work through COVAX to help, with the capacity strengthening, and we've done a lot of work through USAID, as well as the U.S. International Development Finance Corp to help regional vaccine and manufacturing capacity. But this would go further by attaching endemic infectious diseases support with the pandemic surveillance that we're looking for. Two, we need to invest in supply chain diversification and sustainability because when there is a crunch, those who get left behind are those who have the fewest resources, and ensuring that we have sustainable supply chains helps, including mapping out essential medical product manufacturing capacity in low and middle income countries helps us build that sustainability and reach our goals of equity. And then the last is we need to integrate research into our response. And that means integrating clinical practice and clinical research during an emergency, but also ensuring that we have supporting technologies such as innovative ways to reach the home and remote locations of care, telehealth, physiological monitoring, home diagnostics. All of these things both help the future state of pandemic prevention, but also improve equity. And then very last thing that I'll add is we need to look beyond the present moment. Look at the impact of long COVID, or what we discovered after the West African Ebola epidemic, the post-Ebola virus disease syndrome. We need to look beyond the acute setting and have healthcare systems and research systems that help us understand the total burden of disease after a pandemic.
Thank you so much, Dr. Bedelia. Your vision is inspiring and certainly excites me, and I'm sure all of us also. So thank you so much. With that, I think I will turn it back to Dr. Hepburn. But thank you again, Dr. Bedelia.
Thank you, Dr. Crane.
Wow, unbelievable. What a great start. I wish I know everybody's busy. You got to go back to fighting the pandemic after the webinar. But I mean, just a truly, truly outstanding discussion, and appreciate again both of you for your service, for your dedication, and thank you for sharing your wisdom with all of us today. So we're going to move on to the second panel. This is Innovation in Biotechnology for Pandemic Preparedness. And this panel we intended to be a bit of the fun part, the exciting, the gee whiz, what is the future promise that that we all feel that hope for the future because of the technology and the progress that we can make. So what we did for this panel, we didn't want a bunch of people just briefing the program and saying, here's what we're doing. I really, really wanted people who get things done. So what I like about our two panelists, and I'll introduce them in just a second, is that they are both action. They are both implementation. They have this track record of being successful in moving our government to sparking breakthrough innovation. So really excited about what they're going to say. So we'll start with Dr. Rachel Florence. Dr. Florence is currently a senior advisor to Dr. Francis Collins, the president's acting science advisor here at the White House, where she works on several scientific initiatives for the administration, including a national hepatitis C elimination program. Certainly something we're all very, very inspired and excited about. Dr. Florence also serves as a senior advisor at the immediate office for the director of the National Institute of Health and as a special advisor for the NIH director on COVID-19 diagnostics. I will also flag that Dr. Florence was really the driving force behind a program called Say Yes to COVID Test. If you're saying, well, that's curious, I wonder what that is. Go to the AP3 annual progress report. You'll see a box that really highlights the breakthrough innovation and also the resilience to drive this concept that we now all accept as normal, which is that home testing can be so useful in pandemic response. Our second panelist is Dr. Sandeep Patel, who is the current director in the Division of Research, Innovation, and Ventures, much easier known as DRIVE. Gotta love the name, in terms of progress. It speaks well for Sandeep. At DRIVE, he oversees a diverse portfolio of investments, partnerships, and novel financing strategies aimed at advancing potentially transformative technologies and capabilities to improve our ability to prevent, prepare for, and respond to health emergencies, such as pandemics. In particular, again, going back to our AP3 annual progress report, there's a box that features BARDA Ventures. Sandeep is the driving force, again, behind this new way of how we think that we can catalyze the best of private sector investment for solving our pandemic preparedness challenges. Dr. Florence, I'll turn it over to you.
Thank you so much, Matt, for the kind introductions and for the invitation. I want to congratulate again our colleagues at the Office of Science and Technology Policy for the release today of the first annual report detailing the progress towards the implementation of the American Pandemic Preparedness Plan. The report, if you've had a chance to look at it, is an impressive document that describes in detail the activities and progress that took place across multiple government agencies during the COVID-19 response. It's a reminder of the achievements in vaccines, diagnostics, and therapeutics in particular, as well as other critical areas. Sandeep, if you don't mind, I'm going to address you as Sandeep since we know each other. Sandeep is the director of BARDA Drive and the director of the Division of Research, Innovation, and Ventures at BARDA. You are uniquely positioned to be thinking about the learnings from COVID-19, particularly as they relate to biotechnology innovation, which is the topic of our panel. So you've been thinking about how all this might be used for what we call future pandemic preparedness and future-proofing pandemic preparedness and different pathogens. So let's talk about this a little bit first. We hear about the next pathogen. We hear that it might look very different from SARS-CoV-2 in terms of modes of transmission, incubation periods, symptoms, severity of disease, post-disease syndromes. So how do you think about future-proofing of pandemic preparedness?
Thanks, Rachel. First of all, pleasure to be here with you. Really excited for this conversation. 20 minutes is going to be way too short for this. And thanks to the OSTP colleagues for hosting this and the release of the report. So to your question, I think this is a really important question, Rachel. It's one that keeps me up at night along with my children. And so, what we should do, I think, is to take stock both of the good and the bad of the COVID-19 response, really meet the moment in terms of charting kind of the path forward, preparing against future threats and things like that. I think the pandemic plan lays this out clearly pretty well. What we shouldn't do is over-index to a potential SARS-CoV-3. And what I mean by that is that, there's a lot of viral families out there, pandemic potential. They all have their unique signatures. And we don't know when outbreaks will occur, where they'll occur, how variants will surprise us. And with climate change and human development and global development, this is going to create new opportunities for human-wildlife interactions, zoonosis events, the emergence of new viral families, and even things like fungal pathogens and other kind of threats. And so it becomes very difficult to then prepare for both these sort of known and unknown threats. And so one way I think of thinking about this in terms of future proofing is to consider that focusing on pathogen itself, I think, is only one line of defense. We know, for example, that there are clinical consequences for infections across multiple types of infections, both acutely and post-acutely, chronically, and we're seeing this with long COVID. Sepsis is one example here. You wouldn't think, by the way, that radiation exposure has anything to do with pandemic preparedness. But people who experience radiation exposure can suffer dysregulation of their immune system, which is sepsis, in a similar way that people might experience dysregulation of immune systems due to SARS-CoV-2 infections or other pathogenic infections. So many of my colleagues at BARDA over the years have really pioneered this approach of thinking about this problem from the disease perspective, right? And starting to think about, well, if we had treatments for sepsis, if we had treatments for things like acute respiratory distress syndrome, right, the damage to the lungs from things like SARS-CoV-2, we would be in a position where we would have treatments for multiple types of outbreaks, and we would be better prepared to be able to hedge against some of these unknown threats. It also has the advantage of actually shortening the list of what we need to develop. And so I think this is a really key approach to future proofing. We started a program a few years ago called Solving Sepsis to really drive at this. There's been a lot of progress in terms of these amazing diagnostics that can help predict, whether you might experience sepsis in the future in multiple care settings. And I think these are going to be incredibly powerful tools against pandemic preparedness as they get adopted and scaled. The second point here is I think we need to start thinking about pandemic preparedness not as a separate problem from health and wellness generally. This point was made earlier, but I just want to emphasize this because, having a functional health and wellness system, which includes closing health equity access gaps, is probably one of our most effective defenses against pandemics. What makes me optimistic is that there's a revolution happening in our healthcare system right now, right? There's advances in science technology that are driving new digital health tools, social behavioral insights, synthetic biology, advanced manufacturing, new types of distribution channels, new ways of doing clinical trials. These are incredibly powerful forces for good, not only in our healthcare system to develop and make accessible, new life-saving medicines, but to use this system then for pandemic preparedness. The last point I want to make in terms of future proofing too is while we know we need to develop a set of products and have a certain capability to be prepared and really try to get to that preventative state, we also know that there's going to be unexpected scenarios. There's going to be elements of an outbreak that we don't know, and one of the most effective tools that we have is just our system of partnering across government, across industry, and across the different partners there. At BARDA, I think we're really proud of the fact that we've, the partners we've had in industry helped drive a lot of the development of the mRNA vaccines and things like that when it was needed in a rapid way. And I think we need to continue to kind of re-envision this model, thinking about new ways to partner across government with industry and different partners. And we actually have a solicitation out. I know Dr. Hepburn mentioned that we're not advocating for our programs, but I wanted to mention we're actually we have a notice out to get input from the community on these types of partnering models, and wanted to flag that. The last thing I'll just say on this real quick is, future proofing is going to be hard, right? It's going to take enormous resources. We've had some great progress, but given the immense losses, the suffering that we've seen during COVID-19, over 1 million American lives lost, 4.5 million globally, and all of the other consequences, I think this is something that we just have to do.
Thank you, Sandeep. Hard to pivot, but we're going to pivot onto another topic that's close to both our hearts. It's the topic of diagnostics. So we both worked pretty intensely on the diagnostic space during the COVID-19 response. And I think you just pointed out remarkable changes have taken place in this space in the past 3 years. When we think that now the American public is now testing for an infectious disease at home, maybe several times a week, with tests that are purchased over the counters in your local pharmacies and at scale. I mean, this is really a revolution. So you were immersed in this. What innovations have you seen in the diagnostic space that you think are worth noting here? And how will they support our future pandemic preparedness initiatives?
Yeah, no, thanks, Rachel. This is definitely an exciting space. I mean, it's remarkable, as you pointed out, to see this sudden shift in acceptance and normalization of home testing. Thanks to efforts from my colleagues at BARDA and you and your colleagues at RADx, I think there's a lot going on. We invested in these in home molecular tests, starting several years ago, and at the time there was a lot of pushback and a lot of challenges in terms of acceptance by public clinicians, regulators, others. And I think we've found ways to push through this and really accelerate timelines across all of our efforts. And it's very, very exciting. I think going forward, what's even more exciting here is that now that we have this sort of infrastructure in place, right? We have this acceptance, this initial acceptance of home testing as a paradigm, the technology that's increasingly miniaturized, lower cost, more accessible. This creates this opportunity, and I think the key question going forward is how will this diagnostic revolution really play out over time? How should it play out over time? And to me, the things that I'm seeing that's exciting, there's really sort of two things that I think are going to emerge that we need to move towards. So one is, the current tests are still, I would say, only give us a fraction of the insights and the information we need to make day-to-day decisions, to manage risk, to manage our lives in this sort of complex setting, right? And the second piece is that, these tests are still reactive by nature. In other words, we need to know what we're looking for before we can design and deploy and make available these tests. And I think there's opportunities to kind of shift on both. On the first point, I think the opportunity is that we go beyond diagnostics that tell us answers to questions like, are we infected or not? And I think the opportunity is, there's been studies, we've supported some work suggesting that, wearables and other commonly available devices, might be able to pick up early signs of infection, even pre-symptomatically. There are approaches now where we're able to potentially differentiate between those who might experience severe versions of the disease and those who might experience mild, predicting sepsis and things like that. We have the ability potentially with these diagnostics to differentiate acute versus chronic symptomology of a disease. So long COVID versus, acute infection, to detect whether you're infectious or not. And I think antigen tests have shown to be a promising approach there, right? And so I think there's a wealth of opportunities to get at these questions that people need to answer on a day-to-day basis and develop the diagnostics for that. And again, miniaturization, low cost of sensors, an increasingly sophisticated understanding of our immune systems. I think these are all driving this ability. And I think going forward, what we'll have to think about is how do we sustain this kind of diagnostics revolution?
Yeah. Sorry.
Go ahead. Yeah.
I mean, I think on that point, we've talked a little bit, and we'll talk further about public-private partnerships in the space and how important they were during the COVID response. The RADx program was one such program. They're now responsible for 3.8 billion tests that have been used in the US since their inception in April 2020. So just to finish on our diagnostics topic, Sandeep, I wanted to ask you sort of a more practical question. So as Matt said, I'm now working on a hepatitis C elimination program. Our diagnostics situation is not good. We have a two-step process. The diagnostics are not where we need them to be. From what you've learned over COVID, how might you see all of that helping our a sort of a concrete example today? How would we improve our hepatitis C diagnostics based on what you've seen in the space?
Yeah, I mean, I think the quick answer to that now is that, now that we have a pathway for clinical studies, we have a lot of underlying platform technologies that have been tested and implemented in real settings. This presents an enormous opportunity to plug and play, essentially, right? To just change out what we're testing for, what we're looking for. We have the ability now to multiplex multiple tests in one setting, and we're seeing this with respiratory panels. And I think, Hep C there's a great opportunity with Hep C and many other pathogens to really kind of integrate this into the existing diagnostics platform in a way that was challenging before.
Great, thank you. Awesome. Okay, so I'm going to move on to another question for you. There's this paradox in pandemic preparedness in that investing prior to a pandemic is generally not economically viable for the private sector, and yet the investment is critical for the response to be successful. We hear a lot of talk about warm base, which means keeping the manufacturing and production ready to go during a lull so that it can ramp up during the pandemic. But is that economically realistic? And so you've been thinking a lot about that. How should we be thinking about commercial sustainability and the private sector, and what's the role of our federal government there?
Yeah, this is an important point. I think we've seen the global GDP drop by something like 3% between 2019 and 2020. That's roughly $2 trillion of value lost. I think and that's on top of all the human toll that we've experienced. So I think there's a clear argument that it's not economically viable to not invest in pandemic prevention, preparedness, and response. I think the challenge, as you pointed out, is the incentives. Is how do we align these incentives so it kind of makes sense? And I think one point I'll make here is that I think this is the reason BARDA exists. I think what BARDA typically does is invest with the private sector in developing a lot of these medical countermeasures in the context of emergencies that may not be commercially viable, right? Where there's a role for the federal government to de-risk and share risk with the private sector. So I think that's important. I think in many cases there isn't that clear alignment. But I think there's a lot of opportunity that we haven't quite realized in terms of aligning this risk. And one example is we launched this program last year called BARDA Ventures. It's a public-private partnership with the nonprofit Global Health Investment Corporation to solve for this very problem. And the goal of this partnership is to invest public dollars the same way the venture capital community would. But instead of, and that is to give cash in exchange for partial ownership of the company and to kind of co-invest in the company. But instead of focusing on commercially viable technologies and companies purely, the spin here is that they're looking at technologies that are going to have key roles in public health emergencies in the future, including pandemics. Disease surveillance, new vaccine platforms, prophylactic therapies, healthcare capacity, computational drug design, clinical trial management. These are all examples where there is a commercial path for these capabilities, and there's a clear line of sight for improving our ability to respond to pandemics. And I think finding that kind of middle ground and making the investments, de-risking it, crowding in capital from the private sector to this is one way that this program is designed to kind of thread the needle of that commercialization question. There's a lot of examples of this. I think there's explorations of mRNA is a great example where there are clearly use cases for cancer immunotherapies and things like that, as well as treating vaccinating against infectious diseases and treating against infectious diseases. And so these platforms are incredibly important kind of dual use technologies.
Great. Yep.
Oh yeah, one last point I wanted to make on this in terms of warm basing. I think to me at least, I think that's probably not the best way to kind of approach the issue. I think it becomes difficult, as we've seen with COVID, to ramp up and down manufacturing capacity with these supply and demand shocks. And it's not just facilities and technologies, it's people and workforce and things like that. I think the key sort of opportunity is thinking about, well, what are the other use cases for a given technology that might sustain it in between pandemics and things like that. And the work from ASPR's industrial-based expansion efforts has really done this to invest in a lot of manufacturing capacity for that purpose. And we talked about this with diagnostics. There's an opportunity to take diagnostics and really diversify the platform. So, great, thank you. Okay, so my last question for you is about novel manufacturing approaches. So, we've heard about the amazing mRNA vaccine story that, thanks to basic and advanced research investments, allowed the development, testing, authorization, and manufacturing of vaccines to millions of people, really at dare I say, warp speed, but that's what it was. Can you talk about other innovations in manufacturing approaches that may be less well known but still critical for future pandemic preparedness? Yeah, there's a lot of opportunity here, and again, this is an area where there's a revolution happening in terms of biologics as medicines and the manufacturing associated with them. I think the couple points here that I think are worth making are that there's an enormous amount of manufacturing capacity being expanded for things like nucleic acid production, protein production, cell gene therapies, and things like that. And those are going to be really important. I think in terms of a rapid response scenario, one thing that we need to push on, and we're starting to invest in a lot of different ways, is the ability to do faster, smaller footprint manufacturing closer to the point of care. As it was pointed out earlier, in places where outbreaks might be occurring in places around the world in low resource settings. I think having more integrated on-demand manufacturing, continuous manufacturing, there's a lot going on in this space, both for nucleic acids and even generic drugs and things like that. So that's really important as sort of one piece of it. The other is that there's a lot happening in terms of synthetic biology. And having entirely new platforms to produce proteins and antibody-based therapies that are going to significantly lower costs over time, I think, and at least that's the hope, right? So that these could be more accessible, more easily available, and be more useful in a rapid response scenario.
Great, thank you so much. Well, Sandeep, this has been a great conversation highlighting really important areas for future pandemic preparedness. For those of you who are interested in learning more, the annual report is released now, and it really does a great job in laying out in great detail many of the innovations that you heard Sandeep talk about today, and things that will help support future pandemic preparedness in our country, but also across the world, as we heard from our other panel. So thank you very much, Sandeep, and over to you, Matt.
Fantastic. Again, a pleasure to listen to. I could listen all day. Wish it was a podcast. I'd be listening, the whole 10-part series and all of that. This was really, appreciate the comments. I would kind of maybe highlight one thing that a theme that flowed throughout each question with both our panelists. And that was this idea of pandemic preparedness isn't this narrow response to a specific respiratory virus, and then everything else is a global health problem or an infectious disease problem or put in another bucket. I think what was clear to you, and I think the annual progress report emphasizes this, is that the things that we're doing to combat global health problems can easily be pivoted to pandemic preparedness. And even more so, the better that we are at global health and at global health responses, the better prepared we will be for that next pandemic. Rachel gave a really good example with hepatitis C virus and the exciting promise of potentially truly eliminating that disease. And as we do that, we will be better prepared for scenarios where we need to rapidly identify someone who's infected and treat them. There are a lot of other really good examples that we highlighted in the report. We mentioned seasonal influenza as an example. We also highlighted antimicrobial resistance, that threat that we all know about, that threat that we all we're very worried about. But also, I think antimicrobial resistance, as an example, allows us to learn and exercise so much. As we diminish that threat, we will be better prepared for future pandemics. So, super excited about the third panel. I kind of don't want this whole thing to end, but we will. We do have to do. Let's dive right into our third panel. And this is on innovation for the future of pandemic preparedness. What I'm really excited about is this idea that when we have the worst of our complex problems and challenges as a global society, that those require solutions from all different professions and viewpoints and perspectives in the solution to that problem. And really thrilled with Dr. Hebler and Dr. Reynolds because they represent that. They represent broad thinkers who have a diversity of experience, and they're just so good at solving problems. So this third panel is going to be great. Let me start. Dr. Andrew Hebler serves as a principal assistant director for health and life sciences and focuses on a range of issues, including COVID, pandemic preparedness, antibiotic resistance, and life science dual use research. Most recently, he was the senior director and lead scientist for global biologic policy and programs with the Washington, D.C. based non-governmental organization, the Nuclear Threat Initiative. On a personal note, I've had a chance to work with Dr. Hebler since I arrived here in October. He is the consummate professional, always mission focused, and it is one of truly my favorite people that I've worked with in my time in government service. I also want to introduce Dr. Elizabeth Reynolds. We'll just call her Dr. Liz Reynolds because she goes by Liz, and certainly is another great colleague we have over here. A special assistant to the president for manufacturing and economic development for the National Economic Council. In this role, she focuses on the administration's domestic policy agenda for manufacturing and industrial strategy, supply chain resilience, and regional economic development. She was formerly the executive director of the MIT Industrial Performance Sector and the MIT Task Force on the Work of the Future, as well as a lecturer in MIT's Department of Urban Studies and Planning. And it turns out that she's also done great work in the biotechnology ecosystem a long way back. So my first couple of days on the job here, I heard about this extraordinarily brilliant senior economic advisor to the president. But she had a little bit of interest in biotech as she looks at that massively broad portfolio. So what I've tried to do is monopolize every single second of her time for this purpose while she's been here, and has just contributed extraordinarily to the AP3 annual progress report. And you're also going to get a chance to hear how her vision on the broader domestic economic policy that for which we fit in so nicely. Dr. Hebler.
Great. Thank you so much, Matt. And a big thanks to also Liz for being here today to speak to us. It's just been a really, really exciting last hour and a half or so, just filled with enthusiasm and just really not only excited about the progress, but the potential for us to make progress in the coming months and years. I wanted to just start by noting just my own personal enthusiasm for being here today as someone who was part of the sort of original team that put together and put out into the universe the American Pandemic Preparedness Plan. It's so exciting to take a moment today to look back on the progress we've made, but also look down the pike at the work we still have to do. It is also really inspiring just to remember the basic ideas that the American Pandemic Preparedness Plan was really centered around. The recognition that we have the scientific capabilities to essentially take epidemics and pandemics off the table as threats to the United States and to the world. And it was really centered around this idea that we had that within our reach was the capabilities to, within 100 days of the emergence of a pandemic threat, develop safe and effective countermeasures to treat it. And ideally, aspirationally, within 200 days, to develop those products at global scale. And we're going to focus a lot on sort of the manufacturing and the manufacturing innovation aspect of that in this third session. We know, though, to achieve those goals, it's going to really require strong investments in not just basic science to plug the gaps in our knowledge on how pathogens spread and how they cause harm, but also really leaning into and accelerating the manufacturing innovation, enabling our supply chains to produce products on US and global scale within days and weeks and not years. And so with that, maybe I'll turn to Liz to offer a few just general reflections here at the top, and maybe then we'll turn our attention to a few areas of discussion. Liz, over to you.
Wow, thank you, Andrew, and thank you all for having me. It's a very exciting meeting, and Matt, your kind words are totally over the top. I am well aware that I am probably the only non-health expert on this panel, or perhaps in the entire webinar. So forgive me all. I do have some experience with biomanufacturing. In part, when I was a graduate student, I was focused on and interested in how we develop manufacturing where the U.S. could compete globally. And as this report and other things showed, there are just tremendous ways in which the U.S. is a leader and can be particularly leader, not just in the innovation, but also in the manufacturing. And so that is my connection to this topic. But more broadly, as Matt was saying, I've been working since day one of joining the administration on supply chains. And on all the supply chains we were not prepared for in terms of disruption based on the pandemic. And as everyone knows, the pandemic exposed enormous national and economic security issues for the country, from PPE to semiconductors to transportation. And I think it's the revelation about how vulnerable the country has been in a whole range of areas that is motivating not only the response we see from on the AP3 report, but really across a whole broad spectrum of industries, and importantly, by the administration. And I think it's important to highlight, and hopefully people are well aware of this, really what I think is an inflection point in our approach to supply chain resilience, our approach to broadly to industrial strategy. If you think about the disruptions that were caused by the supply chain by pandemic, that's one layer of challenge. Obviously, the next layer that we've had most recently on Russia-Ukraine is the geopolitical dynamics. We've got the Russia-Ukraine conflict, China, Taiwan, concentrated dependencies where for critical inputs to our supply chains that we're now much more sensitive to, and a broader, I think, agenda there around democratic versus autocratic governments. Of course, climate change, another critical piece to this agenda, and where we need to be building supply chain resiliency. And then finally, I think as part of the broader agenda for the administration is an equity agenda, where we have seen a growing inequality in the country, part of it based on the hollowing out of our manufacturing industrial base. And that also threatens the social fabric of the country. And so for all of these reasons, we see a real investment in a whole new approach to industrial strategy, one that is very much a hallmark of American industrial policy since the beginning of Hamilton. And so I think what we've seen from the administration is not only laying out the why of that, but now more recently with bipartisan support, the how of that. So this agenda, fits squarely in this broader vision for where the U.S. should be developing in terms of domestic capabilities, but also in line with its allies and partners.
That's great. Thank you so much, Liz. And obviously, well, maybe I'll just note at the top, you shouldn't feel different being a non-health expert. One of the really important things in this field is that it requires expertise across sectors. It's a really complex set of problems, and it's not just different disciplines, it's also collaboration across government, across industry, and across non-governmental organizations, both here in the United States and around the world. So just thank you for being here, and thank you for contributing to this important effort. You've talked a little bit already about the domestic sort of industrial policy and the administration's approach to the manufacturing agenda, and have been really over the last year driving many of the changes the administration has taken to accelerate what has been a really historic recovery in American manufacturing and industrial strength. And obviously, this agenda is helping to revitalize domestic manufacturing and create good-paying American jobs and strengthening American supply chains, and really truly accelerating industries of the future. But I'm wondering if you could just offer your thoughts on how the kind of manufacturing innovation we think in this sector just fits within the administration's agenda to bolster domestic manufacturing and supply chain resiliency.
Well, it's, what's of course the case with manufacturing, the manufacturing sector, is that there's foundational technologies, foundational capabilities that support every sector in which we are actually making something. So when we think about where the priorities have been for the administration, and what steps have been taken, in my mind, it's building a base that has the capabilities, rebuilding our innovation capabilities, both from sort of the early stage R&D to the later stage manufacturing. And so first and foremost has been a recognition that our supply chains are not in a position of strength right now in critical areas. So if people are familiar with the administration's reports that came out just about a year ago, the 100-day reports, which focused on particular areas of vulnerability, which included critical minerals, advanced batteries, semiconductors, and pharmaceutical APIs. And then in February, we released a broader set of analyses across 7 different agencies that were focusing on a broader group of areas, including food security and USDA work, Department of Transportation, ICT. And it turns out that, we've got vulnerabilities across the board. And it also turns out that supply chain vulnerabilities have always been there. But now we're in a world in which they're going to increase at a very, accelerated pace. And I think it's McKinsey that estimated that any company working in a multinational capacity is likely to experience a major disruption every 3.7 years, based on what we're seeing in terms of climate and other aspects. So this is really a new lens to look at our manufacturing capability globally. In countries across every country now needs to look through this lens. If the U.S. with all its resources turns out to have tremendous vulnerability, what does this mean for other countries, low and middle income countries? So that work, I think, has highlighted, and we've done some very specific work to build out and find ways to reduce our dependencies in areas that are going to matter significantly to the biomedical space and medical countermeasure space. So whether it's critical minerals, whether it's semiconductors, et cetera. We've also brought in the use of procurement tools and understanding that the federal government spends a good $600 billion a year on goods and services. And so how can we use that as a tool to encourage investment here? We've brought in tax policy. People are aware of our efforts to create the global minimum tax and how that has been used around the world as a way to, I think, undercut corporate investments or corporate tax-paying, responsibilities. And so that's another area that I think, again, also touches this sector. And I think then if we look at a lot of the recent legislation, which I can get into in more detail if needed. I mean, what we're seeing is that the tools that we have at our disposal are really working. So what are the tools that we have at our disposal? We often are providing loans and grants. We have kind of supply push tools. We have also demand pull tools. So, tax credits and things that signal to the market that we're interested in, and we need to rebuild our capabilities in certain areas. And we have already seen investments, about 100 billion commitments made in electric vehicles and electric batteries. We've seen about an $80 billion commitment from the private sector on semiconductors. We're seeing a whole host of ways in which industry is responding. This is not just a government play. It's a much broader collaboration going forward. And all of those tools, again, critical for rebuilding our capabilities here, but our ability to also innovate in the biomedical space.
That's awesome. You mentioned we're at this inflection point, partly as a recognition of a problem, but also because of this just diverse array of tools and creative approaches we're taking to address it. Part of the opportunity at this inflection point is also just the alignment with legislative victories and legislative vehicles that have provided new opportunities to make really important progress towards some of these goals. So over the last several months, obviously, the president has signed the bipartisan innovation law and more recently, the CHIPS and Science Act. And I'm wondering if you could just offer your perspective on some of the synergies or opportunities you see with these recent legislative victories and making progress, not just towards pandemic preparedness manufacturing innovation goals, but in support of the broader domestic manufacturing agenda.
Thank you, Andrew. I'm glad I'm getting this question today and not 3 months ago, because I have a lot more to say. But it has been an extraordinary moment, and I think what it indicates is that we can find a path forward in a way that's that's, I think, uniquely American in terms of setting sort of mission-driven goals for things that we believe are important for the country, but doing it with the tools and with a very market-driven approach. And so the bipartisan infrastructure law, which many people believe is, and rightly so, that it's about roads and bridges and ports and rail, but it also had an enormous amount of investment in our clean energy base. It's about and telecoms. It's about broadband. It's about EV charging. It's about batteries. It's about DOE demonstration projects. All of these things are part of a broader manufacturing, and they're all manufacturing related. So how can we build that capability in that space? And then, of course, the Inflation Reduction Act, which combined with the bipartisan infrastructure law, is around. It's the largest investment in climate in U.S. history. It's about 4 times larger than anything we've invested in prior, and we've got enormous goals that will really help reduce greenhouse gas emissions by 40%. And then finally, the CHIPS and Science Act, I think critically important for this agenda in particular, in that it's got the microelectronics basis for every industry, including this. Absolutely essential. A third of our inflation last year was driven by the auto industry and the lack of the shortage of global semiconductor chips. That's not a condition that we can all live with as a country going forward. We absolutely need to address that, and the CHIPS Act does that. And importantly, the science part of the CHIPS and Science Act, emphasizing the importance and the R&D investments in many technologies, including advanced manufacturing, including biotech. And that really is pulling us toward not just the R&D, but also toward the applied and translational research, as well as building out our manufacturing ecosystem in ways that are going to benefit in terms of pandemic preparedness as well. So I think, those 3 combined are just extraordinary wind at our backs. It really is a moment for us to be building capabilities. And it's not just, I will say, it's not, I think we need to set the missions. We need to be accountable and transparent. We need to figure out new ways and better ways to collaborate with the public and private sector. We have to rebuild our capabilities internally, in terms of how we do things within the federal government, understanding analytic capabilities, permitting and helping facilitate the permitting process and all of this. And then we have to coordinate with our partners and allies, because we absolutely are we need to invest in our capabilities here, but we absolutely aren't going to be rebuilding everything in the US. We shouldn't be. We need to be more strategic. We need to really coordinate with allies and in terms of regional developments around the world. And so I think those are all parts of not only a plan and a strategy, but now we have actually resources to do it. And so it's truly an exciting time. I think we'll look back in a decade and see this as a pivotal moment for the U.S. and for our also our global relationships.
Yeah, it's very unique to have this alignment of sort of challenge and tools and resources. And while we take this moment to reflect on just the progress we've made over the last year toward American Pandemic Preparedness Plan goals, it's also just exciting to think about the progress we're going to be making in the coming months and years as a result of this really rare alignment. I want to take a moment just to acknowledge the ways the advanced manufacturing sector really stood up during the COVID-19 pandemic to really address some of the major shortages that we experienced with medical supplies and with, in particular, personal protective equipment. And I know it's our hope that the advanced manufacturing sector continues to play this really important role in the U.S. response to future pandemics. But I'm wondering what role you see for advanced manufacturing in contributing to future pandemic preparedness.
Well, Andrew, I couldn't agree with you more that I think that the pandemic actually exposed vulnerability, but also exposed tremendous strengths. I had the privilege of sitting on the Massachusetts emergency response team that focused specifically on how the state's manufacturing base could help pivot and manufacture for PPE and other aspects of the crisis. And I think what came out of that experience to my mind was essentially agility, that we actually have tremendously agile manufacturing companies here that, given the opportunity and given the incentives, really can be there to respond in the moment of crisis, but can also be there to help us, build what we need to be building now for our national and economic security reasons. What's exciting, I think, about the moment here is that we actually are trying to address some of the challenges we have as a country in manufacturing and have, bringing new tools to do that. So when I think about the challenges we have, and this came up in the last panel, and Sandeep was talking a lot about what BARDA is doing to help address our manufacturing scale-up challenges. We have a tremendous startup ecosystem. We have not had such a strong scale-up ecosystem. And we've seen this certainly in climate and other areas, but where we invent it here and make it elsewhere. New technologies are actually going to help us turn that around. If you think about the foundations of modern manufacturing, AI, robotics, additive manufacturing. These are ways in which we can compete in manufacturing of PPE and other areas globally, but we can accelerate. I mean, this is the important part. We have to be able to accelerate, just as all the goals that we have for pandemic preparedness is our ability to accelerate our ability to manufacture and scale. So I think when I look across the landscape as to how we address that scale up, there are financing tools that we're trying to bring to the table. If people are familiar with the Ex-Im Bank, we just had Ex-Im just introduced a domestic manufacturing program that will invest in domestic manufacturers as long as they are either currently or in the future will be exporting 25% of their products. A very interesting, exciting tool. We know that one of the weaknesses we have is that our small and medium-sized firms aren't adopting technology quick enough. We created a program called Additive Manufacturing Forward, AM Forward, where large companies are making demand-side commitments to smaller companies. Because that's what they need. They need the demand guarantee that if they invest in additive new technologies, they will be providing the demand to help pull those companies through on a trajectory that helps reduce lead times, reduce vulnerabilities in supply chain, and also creates, greater sustainability. And then I think most importantly for this agenda here is the Manufacturing USA Innovation Institutes. If people aren't familiar with that network, 16 institutes set up starting 10 years ago in particular areas that we understand to be critical for the country's advanced manufacturing capabilities. And boy, are they off and running. This is an incredible moment for these institutes that span a whole host of technologies and areas from composites to robotics to additive manufacturing to regenerative medicine, et cetera. I think that those institutes are, they are collaborative. They bring in partners from all, as you mentioned earlier, Andrew, the way we're going to do this is through our various partners. And they've already engaged in addressing areas where they can help with pandemic preparedness. I know the ARM, Advanced Robotics for Manufacturing, has engaged in developing robotics that could help with competitive PPE production, whether it's masks or with gloves. I know that NIMBLE, which is the National Institute for Innovation and Manufacturing Biopharmaceuticals in Maryland, has a vaccine analytics and assays center of excellence, and they are also developing like test beds. They call it analytic test beds. I like to think of that as kind of our pilot demonstration. That's where we need to fill the gap in this country. So they're doing great work, have been funded by philanthropy in the private sector, and play a really critical role for us to get these technologies, from lab to market and in that critical middle stage of manufacturing readiness levels. So I think those are an asset that we're investing in. Again, the CHIPS and Science Act elevates the institutes, and hopefully people see them as a real resource going forward for building our capacity. Now, the one other thing that every single person, I'm sure on this call and elsewhere, will say is one of our challenges is workforce development. We have a shortage of workers. We had a shortage of manufacturing workers before the pandemic. We have an even greater shortage now. And so that's something, again, that's going to take a, federal, state efforts. It's registered apprenticeships. It's investments in programs we know are working already. And so that's another priority for the administration, and I think for this group as well.
That's great, Liz. Well, we are just over time, and I fear a digital hook is going to come and yank us off the Zoom platform. But I would be remiss if I didn't give you an opportunity just to highlight your perspective on the role of international. Obviously, we're talking about a lot of domestic goals, but it maybe just take a minute, and we would just love to hear you affirm the importance, the role that international partners and international collaboration bears on all these issues.
Sure, Andrew, of course. I think that's hopefully evident by the work of the administration since day one. And if we look at some of the work that's been done out of the G7 and G20 meetings and the COVID summits and some of the reports that have come out, clearly this is a priority for the administration. And as this webinar has been emphasizing, now is the time for preparedness, and preparedness is going to be different. It's going to look different than what we've been doing in the past. So we really need to collaborate at a global level to reconfigure ourselves to be successful in this preparedness. And so I think that we've got a lot of conversations going on, again, through the G7, G20, but also a lot of bilateral conversations and other areas in which we've got the Berlin Declaration just recently and a whole host of things that I think are going to be very important. And I hope that the work that we're doing in this country actually will have tremendous positive impacts and spillovers for our global goals as well.
That's great. Well, thank you, Liz, so much. As others have noted, we could probably talk about just this topic all day, but we're going to kick it back to Matt. But what I will note before we turn it back to Matt is when you're the host of one of these webinars, you talk about everybody else, but no one talks about you. And I just want to take a moment to acknowledge just Matt's leadership in this area and just his bold vision and his work over since last October, in taking the audacious ideas that were outlined in the American Pandemic Plan and really working in a focused fashion over the last year to make the really tremendous progress that the report outlines, and just looking forward to continuing to work alongside him and all of you in working to achieve these really bold and important goals. And so with that, thanks, Liz, and back over to you, Matt.
So thank you again, Andrew, or kind of no thanks, a little embarrassing, but much appreciated. We should, again, huge thank you to the panelists. That was amazing. I'm not going to do an Academy Awards laundry list. I want to say thank you. We have a small but mighty team here at the Office of Science and Technology Policy that have been working really, really hard over the last year to make these things a reality. So I do want to start with Dr. Carly Cox, and in particular today, who did all of the coordination and putting together so that we could have a webinar. I also want to acknowledge Dr. Katie Brettel. She served with us as a fellow for a year. Her last day was yesterday. She worked until late evening and then hopped in a car and went to her next assignment. But put her really heart and soul into making sure we had an annual report. I want to acknowledge Dr. Steph Guerra, the Public Health Service Corps Lieutenant Anastasia Lambrou, on detail from the CDC, our communications expert, Jared Adams, and that's our team who, again, made all of this possible. So what a great day. I hope you share my impression that we've really just scratched the surface in terms of all the things that we need to do for pandemic preparedness. I think today gave you a highlight of some of the areas where we are digging in. If you do take a look at our report, which is, again, we're super excited it's out today. We've already gotten some comments back, and one of the comments is, wow, there's a lot there. Wow, I didn't realize we have all these different programs and you're listing them. And that's exactly the point, is that the pandemic preparedness is whole of government. Pandemic preparedness is whole of society. It's really all of us addressing it. And we are really proud, and we are really hopeful of the different groups within our government who have been, again, putting their heart and soul into making sure that pandemics never happen again. So we don't intend for this to be the last outreach event. We're actually planning to do a lot of public engagement over the next few months. And the reason for that is twofold. The first is we really want to talk about here's what we're doing, here's what we're thinking, and really espouse that principle of transparency in our government, which is so important to all of us who you've heard from today. But also, again, from Dr. Nelson and her leadership at the Office of Science and Technology Policy. If you follow what we do, in addition to equity, transparency in our government runs through all of that. So we want to tell you what we're doing, and we have a whole series of events that are planned for that, and we'll post it on the OSTP website. We'll tell you what we're doing and where we're going. But we also want to listen. And we really see this endeavor. It's not an annual report and then we're done, but this is a living document. And our team's probably going to celebrate for about 7 or 8 minutes. And then we're already going to be starting to map out what the next 3 to 6 months and what the report next year looks like, and making sure that next year's report is even better. In that process, we're not in a bubble. We're just the opposite. We want to hear from people. We're going to go out. We're going to listen. We're really excited. We have an upcoming trip to the great state of Washington, and we're going to be visiting biotechnology companies. We're going to be talking about antibody manufacturing so that we can meet that ambitious goal of the 100-day mission. And we're also going to spend a lot of time with the state of Washington Department of Health and all the great experts there, and listen and learn from them, and so that our pandemic preparedness efforts can be even better. So I want to end with a commitment from us and a request from you. The commitment from us is that we are going to do everything we can as a government team to ensure that we learn from the current experience and that we are ready for the next pandemic. What we're not going to do is we're not going to stovepipe. We're not going to say, oh, it's not my responsibility, somebody else. No, we're not going to do that. We're going to view kind of our effort as a government as a portfolio. start to finish. And we're going to integrate all the goodness across all these different departments and agencies, working domestically, working globally, working on the advanced development of products, working on the basic science, and we're going to put all those together. And it's for that purpose to catalyze innovation in our society so that we are better prepared. We're going to listen to you, and we're going to continue to improve. We're going to appreciate the criticism. I love living in a free society because we can express viewpoints, we can debate, and we can deliberate. And I'll contend that ultimately we'll come to better solutions as part of that process. So we are committed to doing better. Now, my request from you is two things. The first is that we take care of each other. I think that's one of the things that was what we noticed in terms of the best of us as a pandemic, is that we took care of each other against this horrible situation and against this horrible virus. What I also am asking from you is that you partner with us and that you stay in the fight. You stay in the fight against COVID, against monkeypox, against influenza, against antimicrobial resistance, and against all of those future threats. And I think going into Labor Day weekend, we certainly wish you a restful weekend. Labor Day, for us Americans, Labor Day is a celebration of the effort that we put in for the noble endeavor of making our society better. And it's meant to be a time of rest. But I also ask that as we rest, but then as we continue to fight against these viruses and these threats that infectious diseases pose, that we stay committed. And in your different walks of life, and we have such an incredible diversity of participation today, but in those different walks of life, that you stay at it. It's to our public servants who are, I ask that you stay resilient, and that oftentimes what you're doing is not appreciated. We appreciate you, and I think all of our society appreciates you. Just you have to remember that and stay in the fight. For students, we got to learn. And we ask you, especially you and the younger generation, learn from our mistakes and make sure that we will continue to improve and to do better, and to never be, and to be encouraged to have that crazy new idea that no one thinks is going to work. But by your persistence will actually transform how we are ready for the next pandemic. I ask, and I would probably conclude in those that are really out there on the front lines, that are taking care of patients, that are the community health workers and the social workers, that are oftentimes feeling discouraged and feeling unappreciated. And I just ask that you have hope. And I hope that we as a government are supporting you. For those people that are truly out there doing, fighting these pandemics on a daily basis, we're here to support you. But what we're also going to do is catalyze the entire parts of our society so that you can truly improve the health of our population. I'm very appreciative that you participated today. We thank you for your time, and please read the report. Thanks, everyone.